Come in, Lori.
Hi, how are you?
Good, how are you?
Good, thank you.
Why don't you tell me about yourself?
Well, I am a certified medical assistant. I have 19 years of clinical experience. I'm currently working for Baptist Health in one of their outpatient primary care clinics. So I'm used to a fast-paced environment, and I feel like those skills are going to serve me well being an ER nurse, because I know that's going to be fast-paced. Everybody comes in with something different, so you really got to be on your toes. So I'm looking forward to that.
Okay, awesome. And where do you see yourself in 5 years from now?
I see myself completing my bachelor's in nursing, and I said I do want to work in emergency care, but I've also had an opportunity to do some medical mission work, and I'm hoping to be able to do more of that. So I'm eager to learn so I can share more.
Okay, and tell me about a challenge or conflict you faced at work and how you dealt with that.
A challenge I had, which turned out to be a very, very positive experience, was I was challenged to develop a patient care liaison program. It's a piece of the care coordination for our physician network. And so I was able to set that up and spread that out into all of our practice clinics that we had. And then I took that a step further, and I was actually positioned in the hospital where I was a transitional care liaison and coordinator, and worked hand in hand with our care coordinators in getting that piece of the program set up. I'm happy to say it's still very successful today and doing well, and we really set it up to try and keep patients from being readmitted to the hospital, and overall help them have better patient outcomes, and it's been very successful.
Okay, and describe a time when you had to handle an unreasonable patient request or deal with a rude family member.
An unreasonable patient request. I do have one who comes to mind. The girls that I work with often would pass the buck to me to handle that. He would tend to be abusive, verbally abusive with staff, very insulting, and I can just remember on one instance that's exactly what happened. He was insulting everyone's intelligence, including the physician, and just having to be patient, work through, talking through it. And as time evolved, that he actually changed and was very different, very kind and courteous to the staff. So it did have a great patient outcome.
Okay. And describe a time when a group that you were a member of made a decision with which you did not agree.
I would have to say, when in my time that I spent at the hospital when I was working in the transitional care, I was part of our the overall multidisciplinary rounding team. And we did have a scenario. It was nothing unusual to have someone come in who had had an overdose. And, you know, in one of those meetings, a physician was saying he was referring a patient to a safe clinic house where he could get clean needles. And for me, I understand that, you know, it's all a process. You can't make people get help that they don't want to have. But for me, a referral would be more of getting them help and not aiding or enabling the current situation that's going on that brought them to the hospital in the first place.
Okay. And do you have any questions for me?
I do. I've read up a little bit on Advent Health, about your healthcare system. I've read some reviews from former employees. So I would just like to know from you, what makes Advent Health a great place to work?
So it is a place that has great benefits for our employees. We do value our employees very much and do incentives and bonuses. And we also are a leading trauma unit, which would be great for you with the ER. And we all act as a cohesive family and are faith-based, which has really led the way of how we run our business and run the hospital as a hospital, not just business purposes.
Okay, very good. Thank you for your time.
You're welcome. Thank you.
Thank you. Look forward to hearing from you.
You as well.